it's very difficult to estimate exactly the source of the difference without looking at exactly how they estimated the cost of the program themselves.
Parliament's Independent Budget Oversight Officer says the federal government has significantly underestimated how much Pharmacare may cost. Though the Pharmacare bill has yet to pass, the Parliamentary Budget Officer reports that over 5 years it'll cost about $1.88 billion. That's approximately $300 million more than the government estimated in Budget 2024.
For a more complete or more refined estimate, we need to get more details on the part of the government. Details matter, especially when you have potentially millions of transactions.
The PBO report is brief and notes there are lots of uncertainties that could raise or lower costs, and estimates will be revisited as more drugs are added. The first stage of Pharmacare would only cover diabetes medications and contraceptives, and provincial plans will need to be negotiated after the bill passes. The Canadian Health Coalition says a clearer picture will likely come then.
As we become more acquainted with the program, how it's going to work with provinces, we'll have a much better idea not only what it's going to cost, but how much it's going to save the system over the long run.
Whether it's costed at 1.5 or 1.8 billion, spread over 5 years, that's less than 1% of the federal budget. I mean, it's actually less than 1/10 of 1%.
The Council of Canadians says the rising cost is an insignificant part of the total $53 billion federal budget. Nick Barry-Shaw adds that he's skeptical of opposition expressed on the basis of cost. He and other council researchers looked at 74 print and web editorials opposed to Pharmacare. Barry-Shaw says in every single case, the authors failed to disclose they were employed by think tanks that receive funding from insurance and pharma companies, or were citing experts that are current or former employees of those companies.
If a drug company is telling you that lowering drug prices is bad for patients, are you going to believe them? If the insurance industry says a government drug insurance plan that covers all Canadians is a bad idea, are you going to believe them? I don't think most Canadians wouldn't.
In Ottawa, Xiaoli Li, City News.